So
Okay.
we're now recording. Okay.
Good morning. Thank you all for zooming in for this morning's meeting. Put the chaos of yesterday and last night aside. We will look at our agenda. First item is the approval of December 3rd, 2020 minutes. Any questions or corrections? I think they're accurate as written. Some things have not come to fruition, like the HHS was going to be involved in testing first responders, et cetera. That didn't happen. It was mostly through Waveney and some at the hospital also. May I have a motion to approve the minutes?
So moved.
Second,
Second.
all in favor? Aye.
Aye.
Again, Alicia, thank you so much for doing these minutes for the last 2 years. It's been phenomenal and very thorough, et cetera.
Yeah.
So we're appreciative of that. And Alyssa, thank you also for stepping up. And we all have different styles and everything else, so don't feel any pressure. But thank you for assuming the role of recording secretary.
Happy to.
Reports, Health Department. Jen, how are we?
Oh, I can't get it to unmute.
No, you had it, Jen.
Yeah, it was unmuted. Now you're muted again.
There you go.
I don't know why it's behaving like this, but I'll be brief because I have a 9:15 meeting with the state. So we finished all the restaurant relicensing. It was all complete by December 31st. Our testing continues at Lapham. These last 3 days, Thursday, Friday, Saturday, are dedicated to the school to help them with reopening plans. Next week, we go back to 6 days a week. Thank you to Anna, Tracy, Carl, and Jenny and Sue for working the site for us. Other than that, the vaccine rollout, still no decisions have been made by the governor besides for phase 1B. We're still in phase 1A, which is medical healthcare workers that provide direct medical care only. So like our PD, for example, and EMS have all been uploaded into VAMS and have started to get their vaccines. The school nurses I uploaded into VAMS. Bethany I uploaded into VAMS. Bethany is going to be part of our team as well. Next week, the state of Connecticut's only getting 21,000 doses of Moderna. They're not expecting any shipment of Pfizer. So hopefully in the next coming weeks, they'll begin to ramp up. So that's where we're at right now.
May I ask a question? I know I'm not formally on the commission, but I just had a quick question. I've had constituents who have, let's say, long-term, they have home health aides that live with them. And from what I can tell from the government website, they are eligible for phase 1A vaccinations. How do they get those vaccinations?
They have to contact me and prove that they are, they meet the criteria that they are a licensed home health care provider, a nurse, a CNA, LPN, whatever. And then I upload their information into VAMS, and then they just get an email from VAMS inviting them to get a vaccine at an area hospital.
Okay, great. So I'll just follow up with you offline. That's terrific. Thank you, Jen.
Anyone that contacts us, I do that for them and let them know that.
Question, should that be communicated maybe in Kevin's next outcall to the town or some other widely distributed, widely heard communication? Because everybody wants to know, not only caregivers like Liz just mentioned, but all different categories. Everybody wants to know when I'm going to get vaccinated, and there's still no schedule, no information that I-
Tom, again, that was in the outcall, that, the governor needs to make the decisions about phase 1B. That's not our
Well,
decision at the local
No,
level.
I understand that, but that would, whatever information we have should be in the outcall. And if the information is simply that we're
It
waiting for
was
the,
in the outcall on Tuesday night.
yeah. Well,
And
that's,
we'll continue to put it in the outcall when we, get updates on who will be next.
yeah.
But I don't think it would hurt to have information about if, you have a home health aide or CNA living with you or whatever, that they are eligible and they should contact the health department.
Right,
That's huge. And it's really hard to find that out.
right. But they also have to be a real licensed one, not I take care of, my daughter, my son, my
No,
whatever.
but someone who's with an agency, I would imagine, that's
If
their
they're with an
employer.
agency, their agency is their employer and their employer uploads them into VAMS.
Their employer's doing nothing.
Well, they should, but yes, I can ask Kevin to put it in the outcall. If you're a home health aide, a licensed one, and you haven't been, uploaded or vaccinated, I can put it into VAMS for them.
All right. Terrific. Thank you.
Is Kevin,
Jen,
is
it's
Kevin in
Penny.
attendance? I don't see him. Kevin, are you here? No, okay.
No.
I'll email him to underline that anyway, about the outcall.
Or
Harrison, it's Penny. There's a follow-up question to that, at which everybody has been asking, at LAPM, and I'm sure, Bethany, you are getting it in your offices as well, is how are people going to know that the vaccine is in town? And what is the call out information going to be for that?
Whenever
They
they decide and how many doses we get, it will go in the outcall, it will go through Aggie, it will go through Bethany's list. We have, spreadsheet after spreadsheet after spreadsheet of seniors. And we
Okay.
also have, seniors that contact us. We also created another new list that we're putting them on as they go in and what their underlying health conditions are. Because again, we don't know if it's going to be 85 and up, 75 and up, 65 and up. And
Okay.
so
So
Yeah,
does that mean then that seniors don't go to their physicians to try and get the vaccination? Does that mean that seniors should be going to the town to get their vaccinations? That's fine.
we do not know yet, not until they know where they fall in the vaccination schedule. If they end up falling towards like general public, when you have CVS, Walgreens, Costco and all them online, you'll know more then. Right
Right.
now, the supply is so limited that's why they're so picky and there's a huge fight right now over should the teachers and essential workers go before the seniors? And that's why there's no decision been made in Hartford either. But it will go through all the normal communication channels of, Bethany, LAPM, and the outcall to get a hold of whoever is next.
Yeah, there's been no word about it going to physicians' offices. It's, the hospitals are dealing with it, nursing homes now, local health, public health systems are also involved. And as Jen said, you've got Walgreens, Costco, and CVS who have been, they're the source of or recipients of the supply, and they are doing it too. To let you know a little bit where it stands, there was a meeting, I think on Monday evening, Tuesday, at the state level about who's going to get what at the next level once they get beyond 1A. And nothing was resolved, and it's amongst teachers, minority and senior citizens, and ill-defined. So, they're still
No,
scrambling.
that's not true.
Pardon
Not true, Harrison. That's not true. I sat through that meeting.
That's what I was told by someone who attended the meeting.
No, I attended the meeting.
Okay.
And 75 and up is in 1B. And if you go to the public health site and the COVID advisory committee, the minutes of that meeting are all online.
Okay, well, that's good. So And they were the only ones in, so there was
No,
nothing with priority in there.
there's.
How about the teachers? Where are they?
They,
I didn't focus on teachers, so I can't
There's-
answer your
Apparently
question.
that's what's being discussed, the teachers or the seniors, who goes, what's the priority?
Yeah.
The committee adjourned, asking for more data. And they had a whole bunch of data requests to people who do that for the state, who were on the call and seemed to know what they were doing. So I would hope that would be forthcoming pretty rapidly.
Yeah.
And said they would reconvene as soon as they could. I haven't seen, I'm gonna look, see if I can find it, when that next meeting is. But they were trying to figure out the priorities between these large subgroups of people who would potentially be in the 1B or the 1C. And I did not get the impression that this decision was slowing down the vaccination process, because the supply of vaccines isn't all that great yet. So it's
No,
not, as-
like I just said, there's only 21,000 doses coming to Connecticut next week of Moderna. And we're still working on healthcare workers and physicians and dentists and, school nurses and stuff like that. So hopefully production ramps up,
I'll bring-
and
Harrison,
deliver-
I'll send you the link, Harrison.
Okay, thank you.
Thank you.
I'll briefly update you on Norwalk Hospital. I think it's pretty similar at Stanford. Norwalk has about 25 to 40 patients with COVID in the hospital. They are seeing significant numbers in the ER, but the demographics with this, as opposed to last March, April, have changed in terms of younger people getting it much more frequently, and a smaller percentage of those need hospitalization, so we're not up to the hospital numbers that we were previously. Norwalk has been vaccinating the healthcare personnel for the last 2 weeks. They were doing about 100, 150 a day. They're attempting to ramp it up to about 250 a day. They were indebted to Fairfield University nursing students for assistance in their program. And they have, well, that's pretty much it in terms of the vaccination. They are going to start coming out to communities, whether they're, beyond the employees of Norwalk Hospital, those affiliated with on the medical staff, et cetera. So they will be involved in the community at the next level once they complete their healthcare provider deal. So they will be going to physicians' offices, doing nurses there, et cetera. And just the latest, and you've probably seen it in the paper, heard of it, about the new variant. Well, it is, it's more contagious. There are significant more residuals in the nose and throat on the swabs. However, the good news with that is, the bad news is more people will get sick with it, and it is more contagious, which is another element for Jen and the contact tracing. That's even going to be more of an issue. But the good sidebar news, two of them, one of which is it seems to be less penetrating to the lung than our present COVID. And
Good.
it's still sensitive, they're saying, to the vaccine. So those are the two brighter elements. And
Hey, Harrison,
yes,
there's at 5 o'clock tonight is a panel discussion from Hartford that Penny may know more about, since Steve Hernandez is the convener of the panel, but there's like 5 players at the state level who will be talking about COVID and I would think answering some of these broad questions. Penny, you know anything more about what?
I don't. It's actually news to me, being on the commission.
Okay, well, I'll send you the link.
Jim, send it to me too, please.
Yes, I'll send it out. I'll send it to Enza, who can send it to everybody. If you're
Okay.
interested in getting into the weeds on this thing, this looked like a interesting place. At least it's a convening of a whole bunch of experts, so-called, in Hartford.
Thank you.
Harrison, I just checked, the next meeting of the COVID Vaccine Advisory Group is a week from today at 6 p.m. And there's no agenda posted at this point. So that's a whole week. So The other thing is the CDC posts every day to the counts of vaccines delivered and given. And as of yesterday morning, so that would be through Tuesday, Connecticut had received about 150,000 doses and had administered 91,000. And the 91,000 was a 12,000 jump from the prior day. So maybe we gave 12,000 shots on Tuesday. So anyway, and that's on the CDC data tracker, and you can check that if you have time.
Thank you, Tom.
Yeah.
Anything else, Jen?
No, just that obviously we're expecting case numbers to go up, with the back-to-back holidays. I mean, it's not going to be shocking when it does. So we're tracking that.
As of a couple of days ago, we had 42 new ones over the past week. What have we had so far this week? Do you know roughly?
In the past couple of days,
Yeah,
we had about 20 something. I don't know off the top of my head.
okay.
I had Julie yesterday from the school system helping us do contact tracing because they're remote this week. So that was good.
Any report on the schools? As far as
They go
There-
back, they go back on Monday. Tomorrow, Brian's having physician one at the high school to test teachers and staff, and some children. And then the kids also are going to our LAPM testing Thursday, Friday, Saturday. So we hope to have all the results back, before Monday, so we know where we're at. So
Okay.
we'll help give-
Dan, I have a question. At Thanksgiving, New Canaan public schools were requiring that kids who traveled be tested when they got back to Connecticut after the travel. But now after Christmas, the requirement is just within the 72 hours of travel, so like before they left their destination. I guess, which I've been getting a lot of emails from people concerned that like kids are being, are like still on vacation right now, are going to be tested in Florida or the Turks and Caicos or wherever they are, another day of vacation, fly home, crowded customs hall, and then roll right back into school because they were tested before they left the vacation destination. What's going to be the policy going forward? And also just people are concerned about this. I'm concerned about it.
Well, I think Brian just streamlined to fall in line with what the governor's orders are. So he's now just following the governor's travel advisory. So the governor's travel advisory allows you to test out of travel quarantine 72 hours prior to coming back or 72 hours after coming back, which I agree. Nobody particularly likes it, but that's the governor's order, except New York, New Jersey, and Rhode Island are exempt from it.
Well, we required it. I mean, I understand that, but we changed the requirement after Thanksgiving. So can we change it back to what it was after Thanksgiving? That seemed safer for kids returning to school.
I don't know. It's Brian's decision. I can talk to him about it, but.
It's in terms of school too, it's the plan is Monday, but he's going to make the call this weekend, depending on the numbers this week and the testing at the end of the week, even tomorrow. So.
If I could just offer too that I'm getting a lot of emails also about this, and including from teachers who wish to remain anonymous, but they're really nervous because they know that students in their classes are still on vacation.
Yeah, it's not a perfect system, and the changes are, subject to interpretation. And it's even when the CDC changed from their original 14 days to 10 and then 7 with negative test, it opens a window, although small, of possible contagion.
I mean, this week was remote in theory, so people would be back from their travel, and then there would be a week of remote to sort of, account for testing and if anyone was, didn't get sick for a few days. But unfortunately, a lot of people took it as an opportunity to extend their vacations. So
Amazing.
Yeah, I will. I'll connect with Dr. Lutzy on that too. Not that it's going to make any difference, but
thank you.
Next on the agenda, Human Services Department, Bethany.
All right, everybody, I'm going to start with the food pantry. We have gone to once a month distribution starting this Tuesday, this past Tuesday we did a couple days ago. The drive up process is working well in terms of clients liking the curb service. Plus it's very COVID protocol friendly, but the downside is the volunteers are having to push carts and load the groceries into the cars. Public Works is helping, and we want to minimize exposure to weather and potential for someone getting hurt from the volunteer perspective. So we're doing once a month. During the winter months, they do get 4 weeks worth of food. So it's a double food pantry. And we'll see, that's been received very positively. So by both volunteers and clients. So
Hey, Bethany,
yeah,
who decides what's in the basket that goes into the car? Is that an order like Walter Stewart's, or does
so
the,
what happens is there's a volunteer outside. When someone drives up, they're given their grocery shopping checkoff list. They fill it out in their car with their own pen or pencil, and then they give it back to another volunteer. And then that volunteer takes it into the food pantry where another volunteer is packing. And then the volunteer brings the grocery cart out and hands it off to another volunteer outside, and they get it in the car or hand it to a Public Works who is directing traffic. So it's very volunteer intensive. We don't want to lose our volunteers. We don't want anything to happen to our volunteers. It's cold outside. It's cold outside. So the clients understand, and we had a successful food pantry on Tuesday. Everyone was happy. The clients actually like it. They don't have to get out of their car, and it's better for the seniors as well.
great, thank you.
Yep. Next thing, client care. Jackie and Marcy will touch upon outreach efforts, and they're doing an amazing job of just the collaborating and partnering and keeping in touch and, maintaining the outreach efforts. Holiday programs, it went seamless for the clients. They were very appreciative of the gift cards they received for each child, as well as during Thanksgiving and Christmas, they received an Acme gift card. There was extraordinary generosity within the community, the New Canaan Moms, PEO chapter, clubs, organizations, NCL, Silver Hill, individuals. They donated gift cards to Acme, Amazon, Walmart, CVS, and Green. And there was just a huge showing of kindness and caring. First Congregational Church deserves kudos. For ringing the bell for the Salvation Army. Very few towns, if any, did it this year. And the youth group from Congregational Church came through, and they raised the highest amount ever for the Salvation Army, which comes back to us, to New Canaan Human Services. Normally they raise, I don't know, they get up to $4,000. This year it was over $5,000. And so the New Canaan Human Services will receive 90% of their bell ringing monetary funds. And so that was great partnering with the church, with Salvation Army, and the proceeds will go to those in need. This fall, seems far away, but this past fall, Farmers Market Voucher Program, we were able to, through the New Canaan Community Foundation, we were able to offer another round of vouchers for the food pantry clients. It was well utilized again, and we look forward to partnering for next season if that's allowed and granted by New Canaan Community Foundation. Approximately $7,000 was generated in income for the vendors, and in return, healthy food for the food pantry clients. So it was a win-win situation for all. The stats for the second quarter for fiscal year 2021. I'm just going to go through a few. We have increased our clientele just a little bit from 160 seniors needing assistance to 167 for this quarter. And our youth and family clients, they increased just one family, but we did have more than one family, but we did have a few families move away. that they needed to move into less expensive areas. So overall, we just gained one more client. Our domestic violence cases, first quarter, we had 5, and that doubled. We went to 10 for the second quarter. Food pantry, our food pantry numbers were up. The individuals that food was given for them, not how, so this is a compilation of everybody in a household. Last quarter, we did 600 individuals received food, and this quarter, 770. So we've gone up quite a bit. And then the shoppers, that equates into, last quarter, we had 240 shoppers, and this quarter, we had 295 shoppers. And they would come once or twice during each month. So we finished our energy assistance program. That's a state program. And this year we had 40 clients apply for energy assistance, and they received rewards for $13,000. So that was very good. And we finished our flu vaccine, although I'm giving 2 more tomorrow. And out of the 330 vaccines, we have used 320. So I have about 10 vaccines left. It went very well. I will order the same for next year.
Is there any flu at all out in the community?
It's very low. It's very seasonal. Yeah, it's because of these measures we're taking for COVID, we are seeing a decrease in transmission for the flu at this point, but it's early. It's really, we're going to start now, January, February. There's probably will be an uptick. And then this past Monday, we had our department budget review. I met with finance and went over areas where we can cut back, but still effectively service those in need. The areas such as office supplies, stamps, subscriptions, travel, they've all been streamlined again. And while still maintaining the funds for food, clothing, shelter, et cetera, for those in need. And so we definitely were keeping within the percentage of staying within what we are supposed to be. I think it's 2% increase maximum. And we are definitely staying within that, if not a little lower. So that's my report. Any questions?
We're assuming we're going to stay with the same staff level through the next fiscal. Is that correct?
Correct.
Thank you.
Got the best team and hopefully adequate numbers, right? So we don't want to change anything.
Yeah, it's going well. It's going well. I mean, everything is just, it's been a year of streamlining and consolidating and just working more efficiently. And it's really, I do think human services, we want to create, and we are creating this availability, the approachability that we're here for people in New Canaan at any level. And we're a great resource provider. And I think word is getting out that we really do. Anyone that works in this department has a passion for helping people. And I think it definitely, we're getting more and more phone calls, and very grateful community. And it just makes us even, want to work harder. So that's where we're at.
Well, didn't you just get a feature in, I don't know, the Advertiser or one of the media?
Yeah, Marcy and I were in there, yeah. And that was well received. We've gotten a lot of positive feedback from that. And we mean it. We mean it. So that's where we're at.
Thank you, Bethany.
Thank you.
Okay. Marcy, anything you'd like to comment on?
Right. I have, excuse me, good morning, everyone. A few short, quick things to report. Our holiday gift bag delivery went really well. We got all 120 gift bags delivered, and I want to thank Russell and Tom and Alicia and Liz and Jen, as well as Bethany and I convinced our 2 college-age children to help. There was, no no's allowed. So it went really well. And we got a lot of phone calls of thanks for that. And as Jim and Bethany were just talking about, the Navigating to Today's Normal series caught Grace's eye at the New Canaan Advertiser. And we had a great interview with her, and we just reiterated that we are here and available, and that we actually really enjoy being here and available, and we want people to ask us for help. So that was a really nice interview. Through call outs, we've been doing a ton. We called between Bethany, myself, Lapham, and Staying Put. I think it was a total of about, what, Bethany, 950 households that were over 80. Bethany and I took on 450 of those. And we still also called our vulnerable population list to make sure that everyone was grocery shopping safely, everyone was getting prescriptions safely, everyone sort of felt healthy and were being cared for as, you know, as they needed. We basically found that most seniors are doing a good job staying safe and staying healthy. However, the frail elderly who are really not able to get out are really isolated. So, you know, that's a real concern, the loneliness and the isolation with these frail seniors. So yeah, as soon as Governor Lamont says 1B is intact, I can't wait to start doing some home visits to these guys, because they are very alone. As far as our shoppers, we have gotten 13 new grocery shopping requests. I guess, you know, all the outcalls from Kevin have finally started to be listened to, and people are taking advantage of these great volunteers. If anyone knows of anyone who may need grocery shopping, please contact me, because we have 67 volunteers waiting in the wings who really would like to shop for seniors. So we still have plenty of help available. And I think that's it for me this quarter.
Thank you, Marcy.
Yeah.
Thank you.
Mhm.
Youth and Family Services, Jackie, want to update us on what's going on?
Hi, everyone. Good to see everyone in the new year. Yeah, I actually was on the receiving end of a few of those phone calls of people giving praise about their holiday bag, or just, you know, like if they have a question and they're calling in with the vaccination, they're just so happy to know they could be handed off to someone that will know the information. You know, I've just a lot of praise. And even I remembered that with the COVID testing callbacks, just people really happy that our town, really everybody is committed to, you know, servicing them, getting them help and support. So it's just positive to be able to answer the phone and hear those you know, that feedback. And as Bethany mentioned, with our fuel assistance apps, all of my clients were certified, which in the beginning there were some hiccups. I'm sure that all the towns were sending in the reports at once, and it's one agency that certifies all of those, but everyone now has been certified. So we definitely can take more people, and I don't think it'll be as long as it was at the beginning. And what's nice is that I think the department that's doing it has been more responsive. So it's been great. And we know, you know, all the paperwork that's needed. I think in the beginning, you know, we were missing some paperwork that they were asking for. So that's great. As Bethany said, holiday rollout went wonderfully. All of our families were really, you know, pleased with how we kept them safe. You know, if they couldn't get their gift cards at the food pantry, we made allowances for them to come here, but, you know, we would meet them in the parking lot with masks. So I just think everyone's really appreciative of that. Also, I've had some clients call me that haven't received their stimulus check. I think there's one that just went out in the last week. The news on that is that they have up until January 15th to possibly still receive that, or then they need to claim it in their taxes. So hopefully they'll all still get it, and there won't be any, you know, confusion with that, which is nice that they know that's, you know, coming in. Definitely have had more rental assistance requests. Some clients were told that are living in subsidized housing, like maybe they didn't need to pay some of the months when they didn't have income coming in, or their rent was being like redetermined or recertified. And, you know, some of them haven't gotten new leases, which makes it tricky for us to assist them, because we obviously need that invoice. None of our vendors can pay off of not having a lease or an invoice for rent. So it's made it tricky. And I don't know if that's COVID related with the offices. But I do know that I don't know if anything's gone out in the news yet, but Millport Housing is being is going to be managed by a new company. I think they were with Conover, and now I think, Bethany, are we allowed to mention if it's going to, who it's changing to, or?
Yeah, I haven't been told yet. I mean, I know supposedly a bid went out for the company that Canaan Parish is using, and so
Yeah.
that might be, they might collaborate, and it would be one management company for both Millport and Canaan Parish, which would be great because it's a great company in terms for human services, working with the what is it, the area manager as well as the on-site managers. They're great.
Yeah, I think it was going to take place in the new
I do
year.
too.
The good news is for us is that we've had a good working relationship with Canaan Parish. So hopefully that can be streamlined and transition nicely. But what's been difficult is for the clients living in those mill apartments and mill housing. I forget what they have two different names, but it's been tricky for us to get those leases, to get that information. Some of them have been, we've even sent some assistance, and the old company is saying like they don't have a record of it. So we've had to, pull up some information for that. So that's, been a little bit tricky. And these are just some things that we get to do, but we have to, help our clients with this stuff. So that's, that's something, but I do notice that those requests have come in a little more frequently. St. A's was another provider this winter with like helping our families with some cash donations. We identify families. They also have a list of running families. So, they sometimes will call us to ask us to, vet sort of some of their situations. Also today I'm doing a Zoom on suicide prevention. We're trying to get some information from the western region of Connecticut. I guess they're doing a good job in like Danbury and those areas. So hopefully that'll shed some light on our area, sort of to have a better response, maybe follow something that's already, successful in another area. So I can let you know what is on that call. And then I think I get to help with some COVID test callbacks. And as anyone knows from the past, I really enjoy doing that. So I'm happy to help out with that. And I'm sure there's more, but if anyone has any questions, please reach out to me. I definitely think our community is working well in terms of, Marcy didn't mention, but the police calls that Bethany said have been up. A lot of family, issues going on with kids being home, or, adults having to move into the homes with, older parents. I think even Animal Control had called me recently about a family. So it's great to know that we can all work together on these issues. So happy to answer any questions.
And I just want to know, Jackie is unbelievable with the contact tracing. I'm so glad she can help with the health department. So Jen, it's great. She'll give her the list, right, Jackie? You're so good at it. No, you get the LCSW going in there and it's great.
Thank you, Jackie. Anything from the commission they want to bring forward? Okay, we'll move on to old business. Mental health update, Jim.
Yes, basically the question that was asked in the December meeting was how many people looked at the Navigating series?
Yes.
And unfortunately, there's no Nielsen rating, but from Bob Doran, we know that no less than 300 people between YouTube and Channel 79 saw each of the 6 programs. Unfortunately, the way the tracking takes place within the 79 system, it's tough to sort out. But again, Bob feels that no less than 300 saw every program. Now, the good news is that he's going to, in another week, start the rotation over again, and of all 6 programs, and basically only run them for 1 week before the change. But as part of the Let's Talk About It program, which we have joined, which is the community mental health promotion, as we'll call it, program, January, we'll run the program from Silver Hill on managing stress and anxiety. So the net is that we'll be still on air for another 3 or 4 months. We'll still be on air on the YouTube for at least through spring, at which time the AARP Connecticut network picks us up. And so we have 2 scheduled sessions that take the core 30 minutes from our program and make it a 60-minute program with Q&A that both Silver Hill will be the first one in early April, and then Dr. Lowe will talk about the connected mind and body in later April. So we'll be on air for a number of months to come. So from the standpoint that we are now part of the schedule on Let's Talk About It, which is the community effort basically led by the New Canaan Foundation, but there's a structure which includes almost everybody that has any interest in any demographic in town that's part of this. And Suzanne Harrison is the editor of what will be a website. There's a, can never think of the name of it. What's, it'll come to me in a minute. Besides video, the audio, what's the name of that, Bethany? That podcast, I'll get it out in a minute.
Yeah, the podcast.
So basically we're covered of all demographics on all media. And in a minute, I'm going to follow up with another 2 thoughts of what the commission can be doing. One is that we want to pick up the good response that we got from Bethany and Marcy on TV, which will come back again. But we want to follow that up sometime in April with a panel with Harrison, Bethany, and Jen at the minimum, talking about what the department has done during the COVID and what needs yet to be done. Everybody thinks that with all the inoculations and whatnot, we'll begin to see a downturn, which I hope is correct. But in point of fact, it ain't going to happen, as we can see from the conversation earlier today. There's still a lot of confusion as to what to do with the inoculations at this stage. We're going to be dealing with this problem, and in 2 other organizations I'm involved in, we count on the fact COVID will be with us through the end of the year for planning purposes. Hopefully by June, things will begin to get a little more normal, but in point of fact, we're going to need a lot of help. And then, as Marcy said, there's an immense amount of loneliness and isolation among many of our seniors right now, and it's going to get worse. So we need to continue to reach out. So the bottom line is we'd like to have another panel at which Bob will take on for us in the spring with our management of the group, as it were, commission. And then finally, I sent out a number of newsletter ideas. The only thing I could see in terms of the missing pieces of media, we're picking up something from what we did with telehealth, which was putting out a monthly newsletter that's basically a compendium of professional medical centers and hospitals and whatnot. And I subscribed to maybe half a dozen of these. And before, what we did was clip these out, put them in an interesting format, because most of the hospital and medical newsletters are boring as hell and are very focused on disease specific. We tried to, with the newsletters that you saw, try to cover a much broader base of everything that might be interesting to a senior, but particularly focused on physical activity. What I'm proposing, or would like to get a feeling from the commission on, is starting this newsletter again, funded by outside money, which I will head up the fundraising. I'm not too worried about coming up with $10,000 or $15,000 to fund this. But it would not come from the department budgets or the town budgets, but would be separate and would be basically a newsletter monthly, put on the emails and any other way we can get it out electronically. So we wouldn't print them hard copy, but would send them out. And so again, I'm thinking that this would be a good project for the commission, and particularly with Alyssa and Lance to help me out, as it were, and anybody else that wants to volunteer for content. And basically, there's no shortage of possible things to put in something like this, and you write fundamentally with your scissors. Plus, I've talked to Bethany and to Mia Handler from Silver Hill that we would get maybe a personal insight, professional / personal insight for our community of what's going on in mental health for seniors. That would be a column that might be in this. So that's kind of the concept. If anybody thinks it's a terrible idea, we'll back off and go chase another rainbow. But I think that it's the one piece of media information for a community information of all age demographics, because they're all suffering one way or the other from anxiety. And we know that it's going to get worse. So any comments, questions, or
questions too? What's the schedule with navigating going back? They're going to recycle it. Is it going to be one lecture per week, or all 6 going to be rotating through a week schedule?
The answer to that is twofold. One is that the Channel 79 sequence would be a weekly rotation. However, all of them are already on YouTube, so you can get all 6 anytime you're so inclined.
Okay.
I want to comment with what Jim said, is that alcoholism has really become, during this pandemic, unbelievable. And people are wondering, I had several calls after this thing of "Are you an alcoholic?" that ran in the New Canaan Advertiser, was very cooperative on the 4 messages. But I had a call, the guy said, after reading the ad, I think I'm going to get sober. How do I go to a meeting? Where are the meetings? And they're all Zoom meetings. And people are not, so as far as what you said, we should have that information available for people that want to go to a meeting. There's no meetings other than Zoom meetings. So we should have that information on how they do that.
Right.
That's all I want to put my.
Signing up for the committee then? The
Pardon me?
newsletter?
Yes, absolutely.
Okay, thank you.
Here, you got it.
My other recruit was thinking that Alyssa as another marketing person would be helpful. And again, anybody that wants to participate with, or that sees the real value of these newsletters, is that it eventually became something where the recipients were sending me stuff that they picked up from their readings and et cetera. So it really became a nice community communication situation. So Alyssa, are you in?
I had a question. How would this relate to the current communications that come out from Human Services?
Such as?
But we issue I get emails every so often with information, and I can't remember the name of it, and I couldn't find it. But it is a communication on from Human Services. Am I correct, Bethany?
Jackie sends out, I think you're thinking the monthly newsletter that Jackie sends out.
Right, exactly. Yes. So would this be kind of like that, but with a different focus?
Well, interestingly enough, I'm not aware of Jackie's monthly newsletter, so I'm not on that list, I guess.
Sorry, Jim. You know, it was a list that was some parents, and it doesn't even get updated because I think it was an old list. So a lot of the parents' kids have probably graduated at this point. And Tom, you might have made it on from, one of those ways. If you, I think it was an Outback Teen Center list. Anyway, long story short, it was created by Kate, who worked here many years ago. And then I just kept it up because people really liked it. So I have put on, I don't think it was on our regular newsletter. I think it's my New Canaan Abuse Prevention Partnership, who Bob Doran is a part of. I have the navigating series and on that. So I'm wondering if I can check to see what lists you guys are on. That might
Yeah, actually, I don't want
be
to
constant
use
contact.
the public, as it were. So, but it would sound like yours was focused heavily on youth-based interests of a segment of the community. The Let's Talk About It thing is a much broader base, again, with the idea that it's going to serve all segments of the community. So we'll wrap
Jim,
our.
just say something too again with it. Let's talk about it. Parents are involved with the RAM Council, and that information should be made available also, but I don't think it is.
All right. Well, again, one of the places I'm going to go for funding, obviously, is to Lauren Patterson at the New Canaan Foundation, who I've talked to about this earlier. So I don't think, first of all, we're not talking about loads of money here. It's basically a little bit of art and preparation. So at the end of the day, we will coordinate with what Jackie is doing and actually use that to help build an immediate list.
I just forwarded Jackie's announcement to all the people in the commission whose email I have. So most of you just got it.
All right.
And I actually, now that I think of it, I do send it. Jim, check your email, maybe your spam. I do send it to the commission, whoever, it might not include, I know Alyssa gets my emails through the New Canaan Abuse Prevention, but I also send it to the commission, but all of your emails might not be updated on that list. But Jim, you've been there for a while, unless you change your email.
I feel bad in that case.
He hasn't been getting it though. So Jackie, could you please send the monthly newsletter to all the members of the commission?
I'll check all your emails that are correct, but other than that, it goes through constant contact. So if you're not getting it, there isn't a.
That's why my filter
There are a
takes
few
out.
of us who haven't
Yes.
gotten it.
Yeah, you got to change your filters.
Why it's not coming. Okay.
Also, Lance, thank you for suggesting that. When you see that the 400% increase in alcohol consumption with COVID in Connecticut, it's impressive. And I think we probably all know some examples of people who are struggling with this, somewhat secondary to this, leisure time at home, et cetera, et cetera. Last part of my question to you, Jim, was when you had the monthly telehealth communication previously, was it a popular item? Were people appreciative? What was the content? As going forward, if we're going to do that again, we want to see what our experience has been.
Right. Well, I would go let Bethany make some comment, but fundamentally it's the bell curve of all communication and particularly to seniors, that there were at one end of the curve a number of people who look forward to it, at another end people who paid no attention, I'm sure, and some that looked at the content, which is part of the reason for the structure of the baby was having a high impact graphic that would grab people's attention and then lead them into specific elements of education. But you want to talk to this, Bethany?
Well, we had two modalities. We did the actual concrete newsletter that we mailed out in an envelope. It was expensive, each mailing. That added up. And then the other was
paid for by outside money, by the way.
yeah. So then we had the email distribution, and we did two modalities. At one point, I sent out a survey saying, how do you like to receive the letter if you want to receive the letter? And it was just mixed reviews. Some said email, some said, very few actually said the letter. Very few. And now it's been 4 or 5 years since our last letter went out. And, I think it's fine to build up an email list. I have 300 people that I've signed up for telehealth, and I've gotten them on the site. Not all the people use the site, but they are email oriented people. So definitely, I think the way to go would be the email blast, as Jackie's doing,
Right.
and cut back on the letters, unless we're going to be reaching out. I don't know. That would be a discussion in terms of our clientele or outreach.
You okay with that, Jim?
Yeah, well, before we execute, actually, we'll cover off a number of bases on this thing, because again, I don't want to duplicate anything that's already going on in the community, but I see this as another step in a media plan. And Doran believes it could be helpful also. And, because we don't know how many people actually watch it on Channel 79 or go to the YouTube, and we don't know how many people, there's a website that's going to be part of the Let's Talk About It. I think that's helpful as a resource, but it's only like the TV programs, only good if you use it. So this is just another way of trying to reach out and educate and sensitize the whole community in all demographics to, again, a mental health focus, but not from my standpoint, I don't want to get into the philosophy too much, but from my standpoint, I think of what we're selling here is a sensitivity education to what mental health looks like. Going back to that 400% of alcoholism. Most people are not going to pay much attention to that until it impacts their family directly. When you have anxiety, most people think of that as a Silver Hill problem, basically. But in point of fact, I would submit that there is no one in this community at any age that does not have some form of anxiety brought on by COVID. So all this is a fundamental, the totality of what the community is offering is basically an education and a set of resources to deal with it as each of us chooses to deal with it. So you never
Jim,
know.
what you're saying is, where do you go for help?
Yeah.
Hey, I've got a problem with with a parent or with a child on alcoholism. Where do I go?
Yeah.
This would answer the question.
Or the other thing, going back to your series on how do you know if you're an alcoholic? This is how do you know if you've got an anxiety issue that's getting out of hand? And so again, nobody knows the ultimate solution, and hopefully by the end of this year, 21, we'll have solved the problem and moved on to something else. But I can tell you that right now, most of the people that I know that are planning for social services across the state are planning on not having any respite until the end of this year.
Yep.
Okay.
Sorry. I was going to ask if I could just, maybe we could talk offline too, but I've just sort of been noodling about what, I feel like we're kind of a clearinghouse. Like we have so much information. We almost have too much information, and it doesn't have to cost any money. It could even be just a Health and Human Services Facebook page for now, but just like a landing page that we could pin things. And then I'm trying to think about interns I've had the last few months that might be willing to help us with a website or something. It could be super easy to navigate, but just everything that we know about, even if it's just numbers, in a way that I think is harder for us to play with the newcanaan.info. That's a little bit more structured, right?
I think it's an excellent idea, actually. That the downside, again, we are between the 10 or 15 of us that are part of the commission and the staff and whatnot, we are picking up an immense amount of information, and it's probably to be able to put that on something besides the Let's Talk About It site.
Yeah, and I'm just thinking also about the amount of work that Bethany and Marcy and Jackie and Jen already do too. Yeah, and then one thing I just want to, I know it's tricky, but if we could talk about like a PayPal link or a donor box link, people really, really, really just want to be able to go onto their computer or phone and donate directly to Human Services. I don't know if that's something we could talk about with the Community Foundation or Bethany. Sorry, am I speaking out of turn?
No, no. I'm just, we've checked with finance because we have received phone calls like, can I do something on PayPal? Do you have Venmo? Do you have something? And checked with finance, and the town is not set up for that.
It's the town.
But so it's finance.
Okay.
That we have to work with, which I think,
Kevin, Liz, and Penny may have an input on this because there's a question when this is arisen, this question has arisen in the past as to where the town's taxes go and where the kind of soft money that you're talking about that people would donate to for the food bank and et cetera.
How about if we ask the Community Foundation to set up an account for people to donate to that would come to these for these purposes?
Well, they have. What's the name of the fund, Bethany, that's currently for people in trouble that the Community Foundation sends over money to Human Services?
So we do get grants from the Human Services. I'm sorry, from the foundation.
They have lunch, an annual lunch, or they use
Touch of Life.
Touch of Life, which we have. They're very, very gracious with that. That's just an ongoing rollover. There's no maximum amount that we use. And then they've given us grants for food pantry, $7,500 for the farmer's market. They're just so generous in terms of, but this is finance because special projects, what happens is when someone donates, what's generated is we get the check or the money is transferred to to Human Services through finance, a transfer, a wiring. And then what happens is ENZA writes up a letter acknowledging the generosity and then for tax purposes. So we send out a tax acknowledgement letter as well.
Right. Well, why don't, Tom, you were on the board. Why don't you and I talk to Lauren at the foundation about whether we could use Touch of Life as the place to.
I would check with finance first. I check with finance first, even if the town can accept.
And check with finance on programs or platforms like DonorBox, which they do record your tax information and you get an automatic email sent that acknowledges that. So maybe there's a way, hopefully, but if not, I understand you guys have tried this a few times.
No, but I think, as well as that tax acknowledgement, I think I always write a note on that letter, like a personal note thanking. I'd still want to continue that.
Yeah.
Oh, absolutely.
But that can easily be done. We can separate the two. Alyssa, I think your point about doing the two types of media, the push out, the outreach, and that's us sending out all this information, or the pull in, and that is really a Facebook page or something, Instagram, something like that.
You can, sorry. Yeah. You can even use, say you use MailChimp. I don't have much experience with Constant Contact. You can use MailChimp. You can use your newsletters as a website. So they're all compiled in one spot, but then you actually have some flexibility in treating it like a very basic website.
Well, and one final thought, and then we can move on, is that the Let's Talk About It people have money and are setting up a website to cover off the mental health issues during COVID, and have a website that's like Action Central that you're proposing. So just like the how we would get money into Human Services, how we get information out. We don't want too many newsletters and too many accounts floating around, but those are all issues that can be dealt with very quickly. And this is just something that I think that the commission and the department should be leading, as it were, the thought process. So this is just a way of doing that.
It's a great idea.
My own little bias is that I would like to keep Health and Human Services as their own entity. And if you do it with pen pal or whatever, aren't there little costs involved in all these things? And also New Canaan Foundation, I mean, they do great work and they distribute X number of dollars in X number of different directions. But we also get checks to Health and Human Services, which can be used whichever way we want. And there are others that are just designated per se for the food pantry or whatever the cause is. And I frankly would like to keep us as our own entity in terms of donations, et cetera.
All right. All right, well, we'll work with you and Bethany and the finance department and start that process. I don't think we're going to be overwhelmed with millions of dollars initially, but I think it's something that could be helpful, and it could be a way to keep the Health and Human Service Department, commissions, et cetera, on people's mind, as it were, and particularly during COVID. I really believe there's a major opportunity and a role for the commission to lead this process in education for the community. So anyway, thank you.
Okay, thank you, Jim. New business, kids in crisis. So last month we did deal with our grant requests. Traditionally, we've given $56,000 to kids in crisis. And this year they were asking for a significant increase to 88.9K. And so Bethany and I had a Zoom meeting with their administrators, and they exchanged all the information. They are involved in X number of services. And just to give you an idea of the scope, the child guidance of Southwestern Connecticut sees, and their age ranges from 9 to 18, they see about 17 patients per year based on last year anyway. And the kids in crisis, just singular individuals, there were 89 meetings, and that's only part of what they do. They have group sessions, they have contact with parents, they have this, that, and the other thing. And Jackie, chime in anytime you want. But they're considered to be a significant component of the services, mental health for all of our high school age kids. So, you know, they were looking for more money. Last year was not a good year in terms of their fundraising. They've had X number of events. I was aware of a golf tournament, which was a significant contributor to it, which didn't take place because of COVID. So they're looking for more money for X number of reasons. They did tell us how, you know, cherished they are by certain communities like Westport, like Richfield, and how they're funded by different charitable organizations, et cetera, including the Board of Ed in some of these towns. So New Canaan doesn't do that. They wanted to keep Board of Ed finances separate from kids in crisis. So we just have, in fact, there were events. Kids in Crisis last year had 776 events where they were involved with individuals, parents, or group sessions. And so that's a significant number. I think they are certainly appreciated, and they appreciate New Canaan too. So even if we didn't come up with the money, they would not let us cut us off their list. And they told us that Darien has been waiting to align with them, but they have not aligned with Darien yet, just to put a little of that New Canaan Darien pressure on us. You know, it's always out there. We don't have football, so now we have kids in crisis. So that's where we are. It felt a little funny. We're financing these people and we don't really, you know, at least we as the commission aren't that involved with knowing what they do or what. So that's why I looked at some of these stats. It was somewhat impressive. I did speak to one of the significant people at the high school who wasn't totally happy because the nurses there seem to be working harder than our representative, who is Grace Burke, in terms of hours, et cetera. But granted, this has been a difficult year, and the nurses right now with the COVID, et cetera, contact tracing, may actually be busier than they are in other years. Grace Burke herself is, she went to Northeastern and majored in and got a liberal arts degree in human services and sociology. She did receive a master's in social work from University of Southern California. So those are, you know, good pertinent credentials, and we know the need is there. It's significant. It's, they have the same issues with, Jackie mentioned suicide. It's not the top of the list, but it's a percentage that they're involved with, as well as Jim's talked about anxiety. We all have anxiety. It's part of life. I think it's part of how we survive. I started to read Sapiens, the book. It's a little depressing reading it right off to realize our connection with chimpanzees, et cetera, is real, at least if we believe what he's telling us. So there are many, many things that could be done. They do want more money. We floated, $2,000 to $4,000 more, and they seem very happy with it. So Bethany disappeared, but anyway, we'll wait till she gets back. So we thought we should go to the commission to see if we can get some more money and just legitimize the bump up in the grant request, and evaluate it. And I think we should, at least some of us, I being included, should have some personal connect, at least with, and you do, Jackie, right? Do you want to chime in on Graceburg?
Yeah, no, and I've mentioned to you guys before, I think maybe 2 or 3 meetings ago, like we could invite her to one of these calls so you guys can hear firsthand, what she does. I mean, this has been a position, Jim, you would know, this goes way back to your days, boots on the ground, with keeping this position in the town, but it's been longer than 15 years and I've been here. I mean, it's obviously the person has changed a few times, but it's just such a needed position because the social workers at the school are already tasked with their IEPs and kids that have 504s, and so there's no room for them to add kids. So this is, guidance counselors maybe find out kids have, if it's domestic violence or depression, anxiety, and the referral could go to Grace. She also works with the position historically has worked with the LGBT community. And as I've mentioned on past calls, the number is growing, even in our middle school, possibly even in our elementary schools. These kids are being identified, but that position is done a lot with those kids. So, so that's, I mean, it's just a needed position. I know that the funding we do give covers salary and part of benefits, but it sounds like I don't understand what the extra costs are for the benefit packages and if there's 401ks and if, what that is. I don't understand, but I do know we've given, a little bit more over the time, obviously, but we don't really ever have extra money to give. Coming from an outside agency budget that stays flat every year, from what I understand. I don't get involved with the funding part, but that if we do give more, it takes away from Get About and other New Canaan Cares, other organizations, and
Jackie, you're muted.
Oh, sorry. Grace would be a great person for you guys to meet, so we can invite her at any point.
One other quick comment is that one of the reasons that Kids in Crisis has been so critical, they handle things that the school staff can't handle legally. And the LGBT is probably one example of that. But there's a lot of things, and particularly in the suicide prevention area, I would think are far more critical to saving lives. So if $2,000 to $4,000 is all it takes to make that happen, to make them happy and keep the service intact, there's got to be that money laying around in the drawer somewhere.
Harrison?
Yes.
The amount of money they're asking, $2,000 to $4,000, is not a big deal. And
Well,
we
we came up with that. We were.
Yeah. However, my question is this. This is different from the other agencies we support. This is a person that we basically cover.
Right.
The others are agencies like Get About or Child Guidance Center, where there's a whole sort of management team that's running an operation. This person, I realize they're part of Kids in Crisis, but they are basically a single person outpost at the high school And who evaluates the effectiveness of this person?
That was the question.
And, we don't, that's for sure, even though we pay for them. And I guess by rights, we should be evaluating them, although I don't know if that's something we could even do.
We have worked with them, like when Jackie and I did the vaping presentation and through the New Canaan Coalition, Emma Kate Friedman, who was the person who last held this position, is the person we dealt with. In stuff that I've done with Jackie dealing with the schools, this person in this role is the person we deal with from the schools.
But somebody in New Canaan who knows the person that who's currently in this position should be evaluating their performance. And then that seems to be missing.
No, I agree with you.
And there was a gentleman named Ed, and I can't remember his last.
Milton.
Yeah,
Milton.
he was very well regarded. I remember when this came up every year, everybody said how great Ed was. And I haven't heard that today, although maybe the person we have now is just as good.
Well, he was here for a number of years and develop relationships, et cetera.
Yeah.
Yeah. No, I think Jackie has got a positive impression of Grace, correct?
Yes, and Grace is brand new. So she started in a year that school didn't even start full time. As we know, the high schoolers went cohort for, I want to say like the first month and a half or 2 months. So she just came on this fall. It's been a tricky position to break into the kind of the culture of the school. The wonderful thing is she is a graduate. She knows the administrators, the teachers. So she has a great connection with, the health department, the administrators. So it's great for her to be the person filling the shoes of someone like an Emma Kate, who is a huge loss for us. But those positions, if everyone didn't know, they were furloughed for the summer. So for her to find another job, it obviously makes sense because I don't think they were guaranteed that they'd be coming back if school didn't start anyway. So we lost.
The other thing, one thing, Jackie, that I was told about that from one of the high school personnel is that was the person last year and they liked her, but it was the money, it was the finances. So that, and Kids in Crisis didn't tell me this, but Silver Hill offered her a lot more money to go there. So she left Kids in Crisis and went to Silver Hill.
Sure.
I just want to say one thing. If she helps but one person, one kid, it's worth it.
Yeah.
Yeah, I agree. But also, Tom, your point's well taken to some evaluation. We hope it's happening at the upper level of Kids in Crisis, whom they have discussions with and monitor how they're performing and what their response is. So, and that's their area of expertise. But it seems like we should know more than just doling out the dollars.
But
So
I do
if
think that, sorry to chime in, Bethany would be able to get this information. They do have someone that does all the statistical information, and that would have to be submitted to us when they ask for that money from us. You know what I mean? Like, so
Yeah,
kids,
we have,
the
that. They give us.
Yeah, so
they
they
give
can
us-
give you all that
got the number.
information.
Right, yeah, we do have their statistics, but it's the quality of the personal interchange and the responsibility and the referral when appropriate, not, et cetera, that we should maybe be more aware of, at least know the person at Kids in Crisis who's overseeing this. But I think for her to come to one of our meetings and just to have a 10 or 15-minute exchange would be a good idea.
Great idea.
And now let's just settle on a quantity of dollars to give them. Bethany had worked into the budget, an additional 2,000. If we have it, I would be in favor of kicking in, bumping it up to 4. What do you think, Bethany?
So when we asked them, Harrison and I had that meeting with the director and other people there. We said we cannot reach this $89,000 from 56,000. And they said, all we want to see, New Canaan is very important to us because we were definitely, we started this program. They started this program in New Canaan. They don't want us to leave. We don't want to leave at this point. So they said, even if you just showed a couple thousand, 4,000 to show that your increments will be increasing, we would be very grateful and enthusiastic. So I'd say, well, you know, for me, I'd say 2,000, but, and then try to maybe contact New Canaan Community Foundation, maybe other something to pick
Yeah,
up.
they are recipients of contributions from, I think, New Canaan Foundation, but certainly other charitable organizations.
And they also, I know there's
It's a
been
big operation.
I think we might be even wanting to spend more money with them if a goal is to get some kids in crisis counselor in the middle school. I don't know. So that's another thing. So I do think, you know, we have a history with them, and I do think we have a future with them. So we've got to work with them. And at the same time, the accountability aspect has to be integrated as well. So
Well, if you're 2 and Harrison's 4, let's do 3 and just be done with it.
Such an odd number.
Money is there somewhere. And if that signal is all they want for the time being, and if she comes and presents and we feel inclined to raise the ante, we will. But I think a short-term signal is all that's needed, and that doesn't cost hardly anything. So somewhere in Bethany's budget, easy
Right.
for me to say, but Bethany.
So
but
keeping in mind line items, you know, I'm in the budget mode right now. And so I think, to me, 2,000, you know, throws a little bone to them and lets them know that we are interested. I'm just trying to cut down on our budget and keeping things at the level that Kevin, the Board of Finance, wants. And so the 2,000, I can do it in terms of where I've been cutting back in other areas. The 4,000, then we're talking an increase in so I'd like to keep it at 2,000.
But
Go with Bethany on this. I think Bethany knows, you know, we're here to support Bethany, and if she has a clear idea of what's appropriate, I think we should support it.
So move.
yeah,
okay,
Thank you.
okay, motion. Anyone?
2,000.
So
2,000.
Second.
All those in favor?
Aye.
Yeah.
Aye.
Thank you, everybody.
Besides, you know, with human nature, every year, you tend to double things. So, you know, 2 will become 4 next year, and 4, 8, and then you're on the road. So I think that's it for today. Thank you.
I
for
have
coming.
Harrison,
Yes.
two things I wanted to say. One, kudos to everybody at Human Services for a terrific job in 2020. Thank you all for going above and beyond the call. My other question is, do we have enough staffing now to handle things for this year? And I'm thinking particularly in the health area, but how does it look right now?
From my perspective, we have the perfect number of people at this time for the demands that we're finding, and as well as for creating, looking at needs and continuing providing needs. I think we're in a great spot. I think we're in a great spot.
Good.
We not only have we have the perfect number and the perfect staff, so I think we are in great shape.
That's great.
And New Canaan is fortunate to have.
And a
all
great
4.
commission, and a great commission. Really-
Well, I was going to get there, but
Okay.
how'd you say it?
Okay, yeah. No, we're grateful. We're for your support. So it goes both ways.
Our next meeting will be February 4th, same time, same station. And Alyssa, good luck with the minutes on this one.
Luckily, I'm a fast typer. You guys talk pretty fast.
May I have a motion to adjourn?
So move.
Second.
All in favor? Have a great week, a great month. Stay safe, healthy.
Here, bye.
Don't watch too much TV.
That's right. Thank you, everybody. I'm going to stop the recording now.
Thank you.
Bye-bye.
Bye.
Thank you. Bye.